Hey everyone, David here, your friendly pharmacist. Today we're going to be talking about rabies post-exposure prophylaxis. Sounds like you guys are going to be doing a lot of hands-on skills with infiltration today. I'm here to talk to you about the drugs and about the patient follow-up. So first off, what is post-exposure prophylaxis? When a patient is bitten by an animal or they're exposed to saliva that may have rabies in it, they may be needing to get post-exposure prophylaxis that involves two medications, immune globulin and vaccination. The immune globulin fights active virus, and the vaccine helps their body build immunity to the virus. That doesn't happen overnight. It involves receiving multiple vaccinations as a series, and it takes weeks for the body to build immunity, which is why we give an immune globulin. In the emergency department, we give both products. After the emergency department, the patient will only get the vaccine, and they'll usually get 3 or 4 additional doses. We'll talk about that soon. First, the immune globulin. This product should be infiltrated around any bite wound or exposure that the patient has been noted to have to rabies, or potentially to rabies. This product is very expensive. It comes as 2 volumes. You can see 5 mils and 1 mil. And pharmacy will dispense volumes according to the patient dose, which is always patient specific based on their weight. So the volume will change based on the patient's weight. The medication is very expensive, this is probably about $6,000 to $8,000 of drug right here. So it is important that when you draw this up, it doesn't get wasted, or we don't have mistakes in pulling it up, because it is quite expensive. The medication should be administered and infiltrated around the site, which you're going to learn more today, but then after the infiltration, there's often drug left over. That should be administered intramuscularly at a site proximal to the exposure site. So if they were bit in the hand, then you would be giving it in the deltoid in the same arm. Any residual, any drug left over after that can be administered into the vastus lateralis, or the anterior lateral thigh, if there's volume left over. For the vaccine, you have, like I said, 1 injection in the ER and multiple injections after the ER. The vaccine should never be administered in the same site as the immune globulin. That's the important piece. After the patient gets their 2 products, they will need to receive information on how to follow up, and that's where pharmacy comes in. Pharmacy has a dosing schedule for their vaccinations. Pharmacy will educate them on where to go for their vaccination series, and usually that is the outpatient infusion center. If the patient is a pediatric patient, they cannot be serviced at the infusion center, so they may have to come back to the ER. But our goal is to help patients get care outside the ER. Last but not least, every patient that gets a vaccine should receive a vaccine information sheet, VIS, and that should be in your resources. That's it for me. Have a great day at Skills Day.